Good morning, everyone. I apologize for any delay in getting up on stage. I was in the back, and Ariana was supposed to clue me, and so I guess you could call me clueless starting out. It's a real privilege to be here this morning, and I cannot tell you enough how much this conversation and all of these days, they always begin with the same theme, don't they? It's all about Joe. Joe and I met many years ago, and we began this conversation, and the conversation started a little bit like this. Joe, you know why people come to the hospital, don't you? He looked at me kind of funny when I asked that question, as many do. I said, it's all about the nurses, right? You can get medical care in many places in the world, but if you need someone to take care of you 24 hours a day, where are you going to go? You're going to go to a hospital. Now, I might give a little bit to the technology side, given all the audience I have here. But having said that, I shared with Joe what has been a passion of myself and many of my colleagues in the audience for a long time, and that is that nursing care and the time that patients get with nurses is critical to keeping them safe. And he said, you know, I think there's something to what you're saying. And fundamentally, we decided to take some of the work that had been started a long time ago with my dear friend, Linda Burns-Bolton, who's in the audience, who will be following me, about what are nurses doing at the bedside today, and how has technology changed that? So we started this study. And what we did is we decided to look at it from 3 different angles, because as we've heard over the last speakers in the last 24 hours, it really is the lens that you look through that makes a difference. Whether you actually watch somebody do work, whether you actually ask people what they are thinking that they're doing, or you actually use technology to monitor it, what you're going to find is that it's a different answer. And there isn't one agreement on what that might look like. So that's what we did. So we looked at a bunch of medical surgical nursing units across our organization, and most of you know UPMC is a really big organization. We have, at this point in time now, 28 hospitals that I have the privilege of working with. And these are just some basic statistics. I'm not going to spend some time on all of these. You can read these, and I'm happy to make these slides available to anyone. And our story has been published also, so please know that this is all publicly available data. One of the most interesting things that we found was just what we kind of thought. What is happening with staff now that we have this thing called the electronic medical record? How much time has it replaced in time that we used to spend with patients at the bedside? Wow, well, you can see the mean percent, and this has all been spread out over a 12-hour shift because obviously that's how most of our nurses work today at the bedside. But 11% of their time documenting, 9% just reviewing, 8% doing patient assessment and interaction. Okay, now I'm starting to get some heartburn. 7% communicating with other members of the team. Didn't we hear this was supposed to be a team sport? And 7% actually providing bedside care in a procedure. Okay. All right, if that's the reality, then what? We then actually looked at bundling activity together because we thought it would be more powerful. So really, when you bundle it together, 22% of the time with patients. Been lots of studies out there that show that's maybe not too far off the range, but 29% with an electronic medical record. 19% in communicating, 12% in medications, and 6% with other technology. When you think about everything we've heard, you really realize that's probably not really good. If the nurse is the one person at the bedside who's here to keep us safe, 24 hours a day, 7 days a week, is that how we want them spending their time? So then we did something a little different. And this was the part that really affected me after I asked these questions. We did surveys because it's the issue between fact and perception. And somewhere in the middle of that is exactly where the opportunity for improvement exists. If you look at the first column, you'll see how much time the nurses believed they were spending with a function versus the actual comparative. Nurses believe, as a mean, that they were spending 52% of their time with direct patient care. And you can say, well, did you tell them what you meant by that? Absolutely, we defined it. We gave them the actual details of how we were going to measure that. 32% in indirect, 15% in waste. And then you can see the rest of it. Wow, look at that statistical significance. This cognitive disconnect just blew my mind. We see them spending 22% of their time, and they think they're spending 52% of their time. And then look at the difference also with the actual time in the EMR. They actually do believe they're spending a lot more time in the EMR than the actual direct observation showed. How do you solve a problem if you don't know what the problem is? How do you engage people to think differently if they actually can't, through their own lens, define it? We use technology, we all have it. We used our EMR, our inpatient EMR, to say, what did it show? What did the inpatient EMR show? Well, it showed that we're spending 2 hours and 50 minutes out of a 12-hour shift in the EMR per nurse. So we're kind of getting a consistent theme. We then obviously wanted to understand this issue of technology. What have we done? Were EMRs good? Were they bad? How do other technologies help us do our job, which is obviously why many of you are here. And you've got to look at this as relative percentages because, we don't spend a lot of time, thankfully, with other technology. But when we do, how are we spending it? 52% of the time, we're using that technology to actually deliver care. That's good. But 28% of the time, we're spending setting it up, and 4% of the time in maintenance, and 9% in troubleshooting, and 7% in tearing it down. However, don't take that technology away. When you look at the belief of the nurses that we asked, how much did healthcare technologies help you be safer? Most of them said, absolutely. It made me safer. But they're still learning. We as an industry within our technology partners still have to make this as simple as humanly possible. And we've heard that over and over again. Simple, easy, direct. Please don't make it harder. Please call it what it is. Please make us allow the work to go forward simply. So when you get into why people feel that way, what were the factors that affected our use of technology, you can see. People like things that are convenient, accurate, efficient, reliable. It works all the time. Biggest issue that makes them not want to use the technology, which we've heard. How many times in the last sessions did we hear that if someone just would have followed the process, it would have saved lives? And why don't people follow the process? It's unreliable. There's just constant work interruptions. It's inefficient. It's slow. And it doesn't give them the information it needs. We have to learn to leverage technology to give us exactly what we need when we need it. We already have more technology, more data in front of us than any of us could ever process, to ever use, to make a difference. Our challenge as technology and healthcare leaders are to figure out exactly what's been stated, to just give what is needed, when it's needed, and how it's needed, and no more. Because I can't deal with more anymore. More is not going to help me do my job. More is not going to help us keep your family member and your loved ones safe. In fact, more, I think right now, will hurt us. And that requires leadership. We've talked about leadership. I want to go back to my last point on the whole deal. This issue of this cognitive dissonance. What is it? Is it really that bad? Do we really have the problem we're here to talk about? I find when I try to engage in painful, difficult conversations with peer leaders across the United States and the world, there is this issue of, oh, Tammy, it really isn't that bad. We're good. To admit that 95, 97, 98, 99% is no longer good enough is really hard. Who likes bad news? I think sometimes when I walk into a room, people run the other way. That's my job. My job is to tell them where we failed. My job is to tell them we didn't get it right. My job is to tell them that that might be someone they knew or they loved. And that's the point that I think healthcare leadership still has not embraced. We must, even though we're great, and even though, I work in an organization where I can actually see, President Obama using mind meld with intellectual capabilities to reach out and high-five each other, I can still see the next day us make an error that causes someone to die. How does that happen in the same place? Yesterday, one of our speakers referenced the phrase of, well, these things happen. They can't happen. The impatience that we've talked about has to come to life. It can no longer happen. Can you imagine what healthcare would be like if we treated each other like we actually knew each other? I know Todd, it's his sister I'm taking care of. I will always go to the length that I need to for the people that I know. Why don't we do that? Are we not taking care of fellow Americans? Are we not thinking about it that way? So it comes down to the systems conversation. We have a lot of broken systems. I've already decided this is generational work. I'm Gen 1. There's a lot of Gen 2s here in the audience. How do we keep this going? How do we keep the passion? How do we keep it alive? Because there's so many broken systems. And I think the answer is actually pretty simple. It's in the pause, and it's in listening to the patient. Our patients don't want much. We've asked our patients, were you happy with the time the nurse spent with you? After all of that, God love them. Yeah, in general, they were pretty happy. Because it is about being nice. They can't judge us from any other way many times. So, that pause is critical. That pause is where we need to begin. And we have to be unwilling to postpone it. I want to leave you with a quote that I thought was pretty relevant given today's situation and the conversation between technology and people and nurses. It's from Tom Friedman. He writes for the New York Times. Some of you know Tom. When you press the pause button on a machine, it stops. But when you press the pause button on human beings, they start. You start to reflect. You start to rethink your assumptions. You start to reimagine what is possible. And most importantly, you start to reconnect with your most deeply held beliefs. And once you've done that, you can actually begin to reimagine a better path. We've talked about checklists, we've talked about pausing, we've talked about listening, we've talked about who knows the most information. Broken systems need pauses. And when we pause as people, for a millisecond, we start to get it right. I challenge all of us to take that pause and to use the energy of this conference to take it back home and actually implement and be passionate about those changes as leaders, because it's all about being courageous. Courage is what we need today to forge ahead. I thank you so much for your time and attention. I thank my colleagues at Massimo and actually the University of Pittsburgh who helped fund some of this work. It's just the beginning of what we need to learn about how nurses spend their time and how nurses make a difference in the care that we need to provide to the people in our hospitals every day. Thank you so much.